Welcome to the program. My name is Eva Maria Ruiz. I'm expert in health policy and public policies. I am interviewing today Lauren Pretorius from South Africa's Campaign for Cancer. This is one of the series of podcasts for shared information with patient advocacy leaders about promising initiatives organized by their colleagues around the world in the face of COVID-19. Lauren, welcome and thanks for joining us today. So tell us a little bit about your work in South Africa or a brief story of campaigning for cancer and some of the organization's main objectives in the patient advocacy space.
So Campaigning for Cancer was started out of a patient trying to access treatment for herself and 9 other patients. And I think at the time we were the only cancer patient advocacy group in the country, but that was some 12 years ago, so we've almost 13 years ago. So we've managed to grow into an organization that looks at access to treatment for patients. We look at patient access on a one-on-one basis, fighting for individual patient rights. But we also work on a policy basis, looking at changing policy and understanding what are the policy issues or the low-hanging fruit that we can win that are quick wins for patients. And I think at the end of the day, the thing that drives us as an organization is the adage of the right treatment at the right time with as few barriers for the patient as possible.
And briefly, how's the situation in South Africa as of today? How's your organization doing these days in terms of meeting patient needs?
So I think there are quite a few things happening in South Africa at this stage. Before the crisis, the COVID crisis hit South Africa, we already had a health crisis in that our health system was failing. So we had that on top of an economic downturn, and then we were hit with COVID. So it's been quite hard. We've had South Africa is one of the countries that has looked strictly at the recommendations of the WHO when it comes to implementing, particularly in the early days, implementing measures of lockdown. South Africa was one of the countries that sat in one of the longest lockdowns, was one of the first countries that sat in full lockdown. And we were in that lockdown for full lockdown for almost 5 weeks. We're still in lockdown. We're on the lowest level possible, but I don't see us coming out of that level for very long. In the meantime, our economy, much like the world's economy, has been devastated. We had a lot of economic issues beforehand. What we're looking at now, though, is that what this has done is it's amplified the problems. So not only has it amplified the economic issues, but it's amplified the health and the social issues. So we've had issues with regards to alcohol consumption and gender-based violence come up, which are things that were simmering, but now there's been a spotlight. We've also had issues on, and while it's now not it hasn't been for the last 4 months, but I see it becoming a problem, is all these patients that have been sitting in lockdown, they were already battling to get treatment. What is it going to look like now? The one thing we managed to do as South Africa is to ensure that our health system didn't fail, and we waited until there were the interventions like the steroids and so on to help patients, that we didn't have so many people in ICU. But we're on a knife edge at this stage. So in one setting, it's been bad in that, but in another, we've been shown the biggest discussion point in South Africa was NHI, National Health Insurance. And it's shown, what COVID has shown is that we can work together and we can look at creating these. So it's been good, but there's been the bad, but the good. We're just looking for the ugly now.
Today, the topic is about efforts to fight what the WHO calls an infodemic or misinformation that has played a larger than expected role in global control or lack of control of COVID-19. What are your experience with this?
So I think in South Africa, where it's come from the government, just the short answer is they've been really good when it's come about COVID and the health issues and the health information. There's more been where they've stumbled is looking at policy and legislative, where they've taken some flack. But from a health information, our government has been pretty good. At the end of the day, if we look at this infodemic, the infodemic was there before COVID. We've seen it a lot. You've made mention of, the anti-vaccine movement. You've made mention of social media and how that can be done. And I think for us, there's a complete overload of information, and people are completely overwhelmed by that. And the one thing I've learned after doing this for 12 years is that your health literacy is not directly linked to your literacy or the socioeconomic areas that you come from, or even the geographic area that you come from. So we can't say that rich people have good health literacy. They have more opportunities to have good health literacy, but it's not a fait accompli. And for me, I think that's what has been an eye-opening scenario for me on this, is what people are really willing to believe and where that information comes from. I think there's two things that we can look at. Is we can teach patients and the public on what is good information. How do you judge if something is good information? I think we're always going to have to fight this thing of the infodemic, and that there might be misinformation campaigns. So how do we teach people to judge if that is? And I think a lot of our education as patient advocates should be on not only providing the information, the health information, but also how do you judge if information is correct? And thus looking at increasing the health literacy of the people that we talk to. I think also as campaigning for cancer, in our experience, it's something that we've been asked from the day we were formed, is information. How do I digest information? How do I judge information? And one of the things that we're looking at is creating portals that guide patients to correct and credible information. Because at this stage, people are needing to help to filter information. In the beginning, it was that there wasn't enough information. Now there's too much information. We need to filter it. And I think that civil society can play a very, very important role in this. And governments and policymakers and decision makers should be working with civil society to try and get these things out, because they can be the custodians of credible information and credible data.
I'm sure you have been seeing some of bad examples of misinformation in South Africa. Tell us some experience or examples that you can share with us around the topic.
So we are, as campaigning for cancer, again, I mentioned we're creating tools that allow patients to receive filtered information that's credible. So we're creating platforms for them to access credible information and to be guided to credible information. We're also creating credible information, and we're creating that credible information open source, in that we're creating the information and giving it to other NGOs to give out and to use. So we're looking at hoping to save money, because everyone's not recreating the same information over and over again. And then the last thing that we're also looking at is the difference between understanding. In South Africa, South Africans understand communicable diseases. We do. We have an HIV epidemic, we have a TB epidemic. So when you talk about viruses that spread and the social behavior that comes with it, we're pretty compliant. In fact, if you look in South Africa, up until now, we're seeing a dip in compliance, but South Africans have been completely compliant when it comes to wearing masks and that. So when it comes to treating COVID and that, we're very compliant, because it's built in. The problem that we have is in the non-communicable diseases in South Africa. is because those risk factors and that aren't understood. And a lot of the time, the risk factors are linked to traditional or cultural factors, the way people eat when it comes to diabetes, smoking and the use of tobacco products. So we're seeing a lot of that coming in, and particularly with cancer, you would think we're seeing, particularly if we look at cervical cancer, we're having to draw the lines between cervical cancer being almost a communicable disease in the fact that it's with HPV. So that's something that we're now taking a non-communicable disease effectively and linking it, because we have such good health literacy when it comes to communicable diseases amongst the general population. So that's one of the learnings that we've reached out of COVID.
You have a seat at the table with the current Department of Health and other government authorities. Tell us if the topic of misinformation have been an issue at that table. Did you have some discussions around the topic in South Africa?
So I think what our government has done is set up a multi-stakeholder social behavior change ministerial advisory committee. So it's a group from civil society that speaks to and advises a series of ministers, not only the health minister, on interventions or issues that are coming out of their society. And I think that's really been a good step in our government. One of the things that we're seeing with the government on this is that at the moment, the information is all top down. So we're running great communications campaigns and providing the material out there when it comes to COVID, but is that really, are the messagings hitting what is needed? And we're seeing that in the fact with cancer patients, where we're having cancer patients want to know how the lockdowns and how the virus will affect their disease. So we're seeing this in that we're not only having to give information that is linked to COVID, but also how COVID impacts on other disease areas in that. And there's a gap in that. We haven't done well in that, both as government and as civil society, but we're starting to focus on that. I think we've also looked at helping to integrate the information in that we've got multiple departments looking at it, and civil society speaking to multiple departments within the government, which it shows us and it speaks to the issues of social determinants of health. It looks at how devastating this pandemic has been. I think one of the things where we're sitting, where a lot of our messaging has been in line with WHO messaging and so on, where we've towed the line on that, particularly when it comes to social distancing and masks, and that we've seen some countries where they've chosen not to do that, or they've chosen to make it not compulsory. In South Africa, it's compulsory. If you're outside, you have to wear a mask. So, and it's a law. We've had that put into law. What we are looking at is the things when it comes to tradition and culture. South Africa has a great tradition of religious gatherings. It's how we as South Africans engage with our community, religious gatherings across all religions in South Africa. And that's been a particularly hard navigation on to understand the need for that as a society and trying to stop the pandemic. So we've had to look at giving information on that. We've had to look at information of how smaller vulnerable groups are being impacted and create information and suggestions and advisories on that. And then also looking at things that you would never think, where we had a discussion the other day amongst ourselves as civil society, where people were talking about burials and how you bury your loved ones, and the social impact that has. We've also talked about how some vulnerable populations, like people who are blind, who need someone to look at are being affected because they're not adhering to social distancing. So there's a lot of sensitization that's coming out that we as civil society are having to deal with in that. And sometimes it feels overwhelming because it sounds like everyone's got a problem, but we're having to look at that and deal with that, and that for me is overwhelming. But we've as a country, we've pretty much pulled together in looking both as civil society and multiple stakeholders working together.
I'm very happy to see that South Africa is doing a very good job on, reinforcement of use of masks and also use of what science learned about COVID-19. Tell us a little bit more about the work that you do producing information on your organization and sharing this information with others.
Haven't solved all the problems, and we're not 100% getting everything right, but there's just definitely a will and an intention from everyone to do that. So we've worked as Campaigning for Cancer, we've worked at a local level and an international level. We're a member of the World Lymphoma Coalition and the World Bladder Alliance, and so they've taken part in looking at how NGOs and civil society and patient groups have been affected by COVID. We've also looked at some of the fears of patients that have come out. One of the things that we're looking in country as Campaigning for Cancer is working with the university to understand the impact of community micro-influences, not online community micro-influence, but the influences in South Africa, in our communities that are people that we can use to seed information and health literacy into the community. In Africa, we have a history of telling stories. So a lot of the time, that's what we're doing, is passing on information from community, from individual to individual in the community. We've just got to make sure it's credible information and right information.
Lauren, do you see an opportunity and a role of the patient organizations in fighting misinformation?
Absolutely. So one of our directors is a gentleman called Cam Batley, and he always said you have to seize the factual high ground and then the emotional high ground as a patient advocate. And I think that if you're not developing the factual high ground yourself and you're relying on other people, that's something that you need to start looking at as civil society. And often we think that these are huge information things that we need to do and huge studies and that, but small things often gather. I look at the Lymphoma Coalition, where in the beginning we just did a quick survey amongst all the members, and that was almost 10 years ago. And that's now gone into a global survey on patient and understanding the needs of lymphoma patients. So you can always start small, and as patients, we need to advocate that we are the holders of credible information. If there's anyone who holds more real world data, it's us. We have that information. So there's two things. We have to advocate as advocates in patient groups that we develop data gathering strategies in our own organization and as a collective stakeholder group. And then we also have to look at advocating at a policy level in saying that the government is supporting us through policy, in that they're looking at investing into research and development and science and technology when we look at that, but then also on helping and looking at us developing the health literacy of the nation. I think that's something that is really, really important, and it is something that any government, especially in the infodemic that we're working on, that it will. I do predict that it will be something that governments and health policy makers and that will have to start looking at.
Thank you, Lauren, for sharing all of these, important thoughts about misinformation and what you are doing in South Africa. Do you have any, final comments?
I think for me, it seems often overwhelming. I think everyone is overwhelmed on this. In the office, we have a saying on this: when we're faced by an avalanche of information or an avalanche of work to do, is that we ask ourselves the question: how do you eat an elephant? One bite at a time. And I think that's how we need to approach this when it comes to information, is digesting information, making sure that we're putting out, each one of us is responsible for putting out good, credible information. And if we can get that right, we're one step closer.
Thank you very much, Lauren, for this excellent conversation today. And congratulations for the excellent work that you're doing in South Africa. I hope to talk to you soon again.
Thank you very much. And it was lovely to chat to you.